Good morning, everyone, and welcome to our second annual One Heart Experience. For those of you who don't know me, I am Sherry McLean, and I am a member of the American Heart Association, Akron's Board of Directors. On behalf of Board Chairman Chris Richardson and fellow American Heart Association Board of Directors leadership, it is my pleasure to be with you this morning. Now, before we get started, we want to invite a survivor to our virtual stage to share her story with you. As many of you know, today is World Stroke Day, and also you know that strokes don't discriminate. A stroke can affect anyone at any age. Veronica Cardello was just 27 when she suffered a stroke. Think about that for a minute. What were you doing at 27 years old? She joins us now, 16 and a half months since that day, to share her story.
Hello, my name is Veronica Cardello, and at the age of 27, I had a stroke. On June 11th of 2019, I hopped in the shower to get ready for work. My vision was blurry, and I kept dropping the shampoo bottle, thinking it was just a figment of my imagination. I lost feeling in my right side as I struggled to move. When I went to speak, no words came out. All I could do was moan and cry. My family found me on the floor of the bathroom 45 minutes later because my father thought it was odd I had not left for work yet. My sisters came rushing to the bathroom to put clothes on me as my father grabbed the car keys to take me to the hospital. Once there, they ran every test imaginable and could not determine what had happened. My father kept telling the doctors I had a stroke, but they were in disbelief because of my age and concluded that I had a bacterial infection instead. 2 days later, my PCP ordered an MRI, and later that week she had called me to inform me that I had all the signs of having had a stroke, but should do more testing. It took 2 months for me to gain full cognition back after this traumatic event. An additional 8 months of testing later with 4 cardiologists, 2 neurologists, and 1 hematologist, and we finally had the answer. I did in fact have a stroke, and that my underlying condition was a PFO, or a hole in my heart. My doctors in Pittsburgh agreed that after I had an allergic reaction to the implant that they wanted to use, I needed to see a specialist who could close my hole using a different method. After an extra 6 months of researching procedures, we all agreed on the Noble Stitch procedure. On October 17th, I had this procedure, and I'm proud to say I am on my way to making a full recovery. Since this procedure, I have embraced what has happened to me as a blessing. I wish to move forward to create awareness that age does not discriminate when it comes to having a stroke or a heart condition, and I want to thank you for your time in helping us to create that awareness with me. Thank you.
Wow, thank you, Veronica. And she looks very healthy today. We wish you continued success and great health. I am sure that we can all agree that 2020 has certainly been one for the record books. From the bottom of our hearts, thank you so much to all of the frontline workers in this community working tirelessly for the past 8 months. Our world has been deeply challenged on many levels, and we are having conversations that we simply never had before. But amidst a global pandemic, we can all assure you that COVID-19 has not cured heart disease and stroke. And as you know, they remain our number 1 and number 5 killers, both nationally and here in Northeast Ohio. And what you've been hearing is correct. Those with pre-existing conditions are at the highest risk for COVID-19, including the 200 million Americans living with cardiovascular disease. It always seems that the problem is like far away out there somewhere, but guess what? It isn't. The need is very real right here in our community. Here are a few of the numbers for you locally. The rate of overweight and obese residents is increasing, reaching 63.5% in Summit and Portage counties. More than 50% of Summit and Portage County residents have limited access to healthy food. And that's interesting. I mean, considering we are considered the most wealthy country in the world. Nearly 28% have diagnosed hypertension. 38% have high cholesterol. 19% of Summit and Portage County adults smoke every single day. And 30% of high school students in this state of Ohio are current, frequent, or daily users of electronic vapor products. Now, as you can see, this doesn't paint a healthy picture of our community, and it clearly points out how critically important the work of the American Heart Association continues to be to the future of our citizens. The American Heart Association is taking action, and we need your help. That's why we're all here today. Now, I know many of you know the American Heart Association through the amazing events that we host. I mean, come on, let's face it. The American Heart Association does great events, from the Heart Ball to the Heart Walk to Go Red to STEM Goes Red for girls. I mean, we touch tens of thousands in our area every year. But these events, they're not simply about a walk or a lunch or a table at the ball. They are about raising funds so that we can implement community programs and initiatives that directly educate and impact the health of our community. We are one American Heart Association with one goal: to be a relentless force for a world of longer, healthier lives. So when you support the American Heart Association, you enable us to tackle the most challenging health issues affecting our community. Our success in both research and community events, both in person and now digital, allows us to confront issues. We have identified our country's most urgent needs and are driving equitable health at the community and national levels, with an emphasis on a few key issues: COVID research, women's health, elimination of tobacco and vaping, high blood pressure, and healthy living, with an emphasis on increasing food access and building mental resilience. The American Heart Association's mission has never been more relevant. Most importantly, we will be approaching these categories through a health equity lens, working to ensure increased access and opportunity across these priorities for Greater Akron's most vulnerable citizens. So today, our local board of directors will take you into each of our 4 health pillars, detail the needs in our communities, explain what work is already being done, and then how you can help. The local American Heart Association team is sitting on several coalitions, such as the Summit County Coalition for Health Improvement, which helps us align with community partners to help tackle some of the issues in our community. But more work is still needed. So the first pillar that we are going to dive in today is nutrition. Hunger and food insecurity still remains a significant problem here in Summit and Portage counties. More than 50% of the county's residents have limited access to healthy food. And that's scary, it's puzzling. But what's scarier is the complex effects of food insecurity, which includes serious health complications, especially when people facing hunger are forced to choose between spending money on food and medicine or medical care, damage to a child's ability to learn and grow, and difficult decisions that seniors have to make, often living on fixed incomes, such as choosing between paying for food or getting critical health care. These are the issues that we are going to be diving into today. With that, I want to introduce you to Chris Richardson, the American Heart Association's board chair for Summit and Portage counties, and also the lead of our nutrition pillar. Chris?
Thank you, Sherry. And thank you all for being here today. I want to start by thanking the entire board for going above and beyond and dedicating their time to a pillar that is important to them. Our board members are meeting monthly in their pillar groups to really help bring ideas and solutions to the forefront. I'd like to introduce members of the pillar team. We have myself, John Park, Chairman and CEO of Westfield Bank, Dr. Mark Eiler, cardiologist for Summa Health, Jim Hewitt, Director of Water Practice for GPD Group, Amador Gonzalez, Principal at Hazelstock Architects Incorporated, and of course, Cherie McLean, local actress and media personality. So, why is it important? You heard some of those numbers that Cherie gave us. More than 50% of the county's residents have limited access to healthy food. Only 26% of children get 2+ veggies a day, and 30% get 2+ fruits, many of those through school meals. Only 22% of adults eat 5 servings of fruits and veggies per day. The members of this nutrition pillar leadership team see the effects that poor nutrition can have on a community. So what are we currently doing around it? The association is working on several fronts to improve Americans' eating habits. Currently, we're working hard to protect nutrition standards in school meals and access to vulnerable children. During the Farm Bill, we formulated and supported strong policies to improve diet, quality, as well as protecting the Supplement Nutrition Assistance Program. We continue to push for policies that would help decrease sugary beverage consumption, shaping and supporting implementation of FDA nutrition initiatives, including menu labeling, nutrition facts panel, health claims, and sodium reduction are other areas in which we work. We also serve as a resource during the development of the 2020-2025 dietary guidelines for Americans. We're pushing for bottling filling stations legislation at state level, and we need to do better for our kids by ensuring they have access to drinking water throughout their school day. House Bill 360 will require bottle filling stations be installed in all newly built schools and in those undergoing major renovations. Teaching gardens. We recently installed a teaching garden at Firestone Park Elementary School in Akron, thanks to funding from Cargill. Teaching gardens address the healthy eating challenges that are facing our nation's children and families by supporting community gardens. This successful approach to engaging youth makes healthy foods fun, and it provides opportunities for children to not only grow, but understand and enjoy the benefit of eating healthy foods. So, some ideas of how companies can get involved. We need your help to make some of these following ideas come to life. As we share ideas that our team came up with, feel free to share any ideas that you have in the chat box. Expanding teaching gardens into the communities that have the lowest healthy food access. Healthy at home toolkits that can be personalized to the needs of the community. Feeling fresh and fruity. Fruits and vegetables are a key part of an overall healthy eating plan. The Fresh and Fruity Challenge encourages individuals to incorporate a fruit and vegetable into every meal for 30 days by sharing photos of their healthy meals on social media. Adopting a school, share recipes and ideas on how to be healthy. Those are just some of the immediate solutions. Some larger scale thoughts from the Pillar Group include healthy vending machine options, community gardens, and community refrigerators. If this pillar resonates with you, put the word nutrition in the chat box. Thank you again, everyone. Back to you, Cherie.
Thank you so much, Chris. Wow, we're doing a lot.
Yes.
Healthy eating is one of the most important things that you can do for your body. A healthy diet and lifestyle are your best weapons in the fight against heart disease. Now, while nearly 80% of cardiac events can be prevented, cardiovascular diseases continue to be a woman's greatest health threat. That's why our second pillar is women's health. Women continue to face inequities when it comes to access to and quality of healthcare. That's surprising. We also recognize that heart disease disproportionately impacts people of color and those without access to preventative healthcare and the poor. Now, I'd like to introduce you to Jolene Lane, She's Chief Diversity Officer at the University of Akron, also American Heart Association board member for Akron and Portage counties, and a member of our Women's Health Pillar. Jolene?
Good morning, everyone. It's a pleasure to have the chance to speak with you today, and thank you very much, Cherie. I'd like to introduce the other members of the Pillar team. My fabulous colleagues focused on Women's Health Pillar include the leader of the Women's Health Pillar, Sandy Reed, who's Vice President for Corporate Communications and Strategic Planning Administration for the Davy Tree Expert Company. Jody Wolf, a community advocate. Lori Schaefer, Vice President at North Akron Savings Bank. Dr. Zinab Lake, a specialist in cardiology at Cleveland Clinic. And Amanda Weish, Co-Vice President of Brennan, Manna, and Diamond. So why is the Women's Health Pillar important? There are several reasons we have chosen this as our focus. Heart disease and stroke cause 1 in 3 deaths among women each year, more than all cancers combined. Fortunately, we can change that because 80% of cardiac and stroke events may be prevented with education and action. The members of the Pillar team agree that oftentimes women don't pay enough attention to their health because they're always nurturing others and sometimes ignoring the science about their own health. Also, we want to influence younger generations of women and educate them about behavior change to value the importance of focusing on their own health. It's also important to note that only 39% of women receive bystander CPR in public, compared to 45% of men. The American Heart Association's new CPR guidelines call for CPR training and address gender-related barriers to improve rates of bystander CPR performed on women. So what are we currently doing around women's health? The Go Red for Women campaign. In 2004, the American Heart Association faced a challenge. Cardiovascular disease claimed the lives of nearly 500,000 women each year, yet women were not paying attention. In fact, many even dismissed it as an older man's disease. To dispel the myths and raise awareness of heart disease and stroke as the #1 killer of women, the American Heart Association created Go Red for Women, a passionate, emotional, social initiative designed to empower women to take charge of their heart health. The local campaign and luncheon increases awareness and is a fundraising campaign in Akron and our Portage and Summit counties, STEM Goes Red for Girls campaign. The STEM Goes Red is designed to provide young girls insights into the possibilities and potential they possess to make a real impact on the world around them. Our goals are to engage young women and mentors in STEM Goes Red, increase the number of women pursuing STEM degrees in higher education, close the gender gap in STEM jobs, arm students with tools and resources to experience good health and well-being. Additionally, we've provided infant CPR kits to the community that contain everything you need to learn the life-saving skills of infant CPR and infant choking relief in about 20 minutes in the comfort of your own home. The kits can also be used in hospital labor and delivery programs, including neonatal intensive care units, to teach skills to new parents, allowing nursing staff to focus on patient care. Here are some ideas of how companies can get involved. We need your help to make some of these following ideas come to life. As we share ideas that our team came up with, please feel free to share any ideas you have in the chat box. Putting educational messaging on non-traditional media outlets where women frequent. Engage younger generations. Create podcasts focusing on women's health to meet younger generations of women where they are. Healthy at-home toolkits, which Chris has already explained. Expanding partnerships with the schools to include teachers and students, and also other service organizations and faith-based organizations. Increase education about adult and infant CPR. Traditional media campaigns to target women and children on platforms like Facebook, Twitter, and Instagram. community conversations about these important topics. If this pillar resonates with you, please enter the words women's health in the chat box. Thank you so much.
Thank you so much, Jolene. Throughout a woman's life, health issues like pregnancy and pregnancy prevention with the use of birth control and menopause can increase the risk of developing high blood pressure. Nearly half of American adults have high blood pressure, and many of them don't even know they have it. That's why hypertension is known as the silent killer. Most of the time, there are no obvious symptoms. But when left untreated, the damage that high blood pressure does to your circulatory system is a significant contributing factor to heart attack, stroke, and other health threats. I now would like to introduce to you Dr. Justin Dunn. He's president of the American Heart Association Board for Akron and Portage counties, and he's also the lead of our blood pressure pillar. Dr. Dunn?
Thank you, Shree. And welcome everyone. Again, my name is Justin Dunn. I'd like to speak to you a little bit about the American Heart Association's work with blood pressure, hypertension. So let me start by introducing the other members of our pillar team, starting with Amanda Wage, co-vice president of Brennan, Manna, and Diamond. Dr. Jeffrey Hallam, professor and associate dean for research and graduate studies at Kent State University. Brian Adams, director of ambulatory services at UH Portage Medical Center. Dr. Anjan Gupta, director of the cath lab at University Hospitals Portage Medical Center. And Kevin Rushing, director of the Bursar's office at the University of Akron. So why is blood pressure important? Arguably, no single risk factor has more impact on the nation's death rates from cardiovascular disease than blood pressure. It's the second most preventable cause of heart disease and stroke deaths, only second to smoking. So many of our pillar committee members deal with hypertension every day as part of their jobs and see the effects it has on the community. We're constantly amazed by the number of people with high blood pressure. And the numbers that we've shown here of people with diagnosed high blood pressure are relatively small in comparison to the number of people who actually have high blood pressure and don't know about it. Prevalence of blood pressure, high blood pressure is very high and awareness is very low in our community especially. So what are we doing around blood pressure currently? So with the American Heart Association, Summa Health's Check Change Control Program, in local barber and beauty shops and faith-based organizations helps identify hypertension in higher risk communities. Target BP is a national initiative with the American Heart Association in response to the high prevalence of uncontrolled blood pressure. Target BP helps healthcare organizations and care teams at no cost to improve blood pressure control rates through an evidence-based quality improvement program and recognizes these organizations that are committed to improving BP control. It essentially gives them a roadmap to success. We also have the development of self-monitoring blood pressure and telehealth. Now, what are some ideas of how companies can get involved in helping blood pressure in our community, helping treat blood pressure in our community and identifying blood pressure? We need help to make some of these following ideas come to life. And as we share these ideas that our team came up with, feel free to share any ideas that you have in the chat box. Implement non-traditional blood pressure education and screenings. Expanding our Check Change Control program. Education through our faith-based organizations, as well as screening. Creating turnkey programs for HR departments at local businesses. Community conversation series. And use traditional and non-traditional media outlets to spread awareness and education. Now, if this pillar resonates with you, please put the word blood pressure in the chat box. Thank you everyone for your time. Back to you, Shree.
Thanks, Dr. Dunn. So blood pressure spikes when nicotine is in your system. And in Summit and Portage counties, nearly 170,000 adults smoke every day. What's even more shocking is that 30% of high school students in this state are current, frequent, or daily users of electronic vapor tobacco products. You know of these products. They are e-cigarettes or vapes. Many people think vaping is less harmful than smoking. Now, while it's true that e-cigarette aerosol doesn't include all the contaminants in tobacco smoke, it still is not safe. I now want to bring to the stage Dr. David Custodio, President-elect of the American Heart Association Board for Akron and Portage counties. He's also the lead of our tobacco pillar. Dr. Custodio?
Other members of the pillar, Cherie McLean, local actress and media personality, Corey Kendrick, who is the Policy and Legislative Affairs Manager at Summit County Public Health, and Rhonda Larimore, Chief Human Resources Officer at Akron Children's Hospital. You know, people ask, why is it important? Why did I pick the pillar? On a personal note, I lost my mother to lung cancer when she was just 51 years old, and I was a very young man. And so obviously smoking is important to me. In my professional level, I practiced emergency medicine at Summa Health and saw on a day-to-day basis how smoking affected people's lives and chronic health problems associated with it, not unlike Dr. Dunn and the other cardiologists who practice here in Akron. And then as a executive at Summa Health, where we're a population health company, we know how important prevention is, and stopping smoking is one of the key of things that we can do to provide good health. Prevention is the key when it comes to heart disease. 80% of heart disease is indeed preventable, and smoking is the #1 preventable cause of heart attack and stroke death, as Dr. Dunn alluded to. While fewer people are smoking now or starting to smoke than ever before, many are using other forms of tobacco and electronic nicotine delivery systems. And this increase in e-cigarette use, known as vaping, by kids and young people in recent years is a serious public health threat. So what are we doing about it at the AHA? We have panel discussions with students in local schools. You may recall that we had the e-cigarette panel discussion with some of the local students following our One Heart in January. We have smoking resources to help people stop. Call 1-800-QUIT-NOW. The Tobacco 21 legislation that we've been working with several cities passed locally, then state and federal levels passed. We're enforcing ordinances where several cities have passed local enforcement, and we need ongoing work in this area. Community conversations to provide education and awareness about the hazards of smoking. We need to continue to convene youth and community leaders to educate about the dangers of tobacco and e-cigarettes. The youth marketing programs like AHA Kids Heart Challenge, which educates students again about the dangers of smoking and vaping. Our Summit County Youth Vaping Task Force and Kent Vaping Task Force, AHA sits on these local boards, which focus on policy change, alternatives to suspension, and then educating the community. And then also there's the Quit Lying campaign targeting Big Vape, who falsely states that e-cigarettes are safe. So how can you help us out? How can your companies get involved? We need to make some of the following ideas come to life. And as we share the ideas that our team came up with, please feel free to share any ideas that you may have in the chat box. So do you have anti-smoking policies in place? Do they reflect vaping? Can you rewrite those, or can we help you rewrite those? Can you adopt a school and help educate them around tobacco and vaping? Can we be more positive influences for youth in our community? Can you help with a teen voice video? We need more panel discussions at local schools, and we need to continue to work with the national advocacy efforts. So if this pillar resonates with you like it did with me, please put tobacco in the chat box. And thank you again for everyone for joining, and let's take it back to our host, Cherie.
Thank you so much, Dr. Custodio. Wow, I know you've heard a lot of great information this morning, and we hope that you are inspired to be a part of the American Heart Association's mission to be a relentless force for a world of longer, healthier lives. I know I was personally encouraged to hear that the American Heart Association is working toward health equity for all of us, because this is an issue that I'm passionate about. It feels good to know that we are working together toward a common goal, because together we truly are stronger. And together we will achieve longer, healthier lives. But we've got a long way to go if we want to achieve these goals that our board talked about today. And how will we get there? Well, through the generous support of individuals just like you. It's only through collaboration with like-minded organizations and individuals that this work will continue to grow. If you're already involved with the American Heart Association, I applaud you. Thank you so much. And I hope you've learned something new today, that you continue these conversations with your American Heart Association team representative. If you're new to the American Heart Association, I hope you were impressed, because guess what? I always am. We ask that you join us as a catalyst for transformational change in our region. What did you hear today that inspired your passion? Please take the first step in bringing your passion to life by working with an American Heart Association team member on a plan for your personal or company impact. And the American Heart Association makes it very easy to make that impact and offers many ways for you to give. We gratefully accept personal donations, corporate and employee support, and donations through your committees, your boards, or your connections. It truly has been a pleasure being with you this morning, and by attending the One Heart experience, you have opened the door to what is possible. Now, let's join together to make the possible a reality. Thank you so much, everyone. Have a great day, and the weekend's coming up, so have a great weekend.